is Rachel Timperman, and I'm with St. Louis University to talk to you today about ADHD. ADHD stands for Attention Deficit and Hyperactivity Disorder. This makes it difficult for people to pay attention. It causes impulsive behavior, it causes restlessness, constant moving. This also causes a lack of organization in this person's lives, to the point where it kind of interferes with tasks that they need to remember to do. ADHD is caused by a lack of dopamine and norepinephrine in the brain. These are neurotransmitters that play an important role in a person's mood and emotions, cognition, behaviors, and that's really why that's the biological reason behind why this disorder is a thing. You can be diagnosed by a psychiatrist. There's a number of things that they do. There's a big long list in the DSM-5, or the most recent DSM, and there's a list of symptoms, hyperactivity symptoms, and also symptoms of inattention. For kids 16 and under, they must have 6 or more symptoms of hyperactivity and 6 or more symptoms of inattention. For adolescents and adults 17 years of age and older, they have to have 5 or more symptoms of inattention and 5 or more symptoms of hyperactivity. There's 4 more things that are required to make a diagnosis for ADHD. 2 or more symptoms of hyperactivity and impulsive behaviors before 12. It must have happened in 2 or more locations. It has to interfere with your daily function. It also cannot be explained by any other mental illnesses. There's 3 different types of ADHD, one being the mostly inattentive presentation, one is mostly hyperactive presentation, and the third one is combined presentation, both hyperactivity and inattention. Now that we've defined what ADHD is, let's look into some facts and myths about this disorder. There's a lot of myths and confusion surrounding this disorder. One myth is that only kids can have ADHD. This is false. Approximately 6 to 9% of children in the U.S. have ADHD, and 3 to 5% of adults in the U.S. have ADHD. So with ADHD, it's more predominant in kids, and as kids mature through adolescence and transition to adulthood, the brain changes a lot, and the brain chemistry will change too. So ADHD, often the symptoms decrease. Sometimes they go away, but this disorder is something that is prevalent in both kids and adults. Some people think it's caused by bad parenting. This is also false. People are like, you need to punish your kid more. Tell them to sit down and sit still when they're not. They think it is something that parents can control, and a lot of parents try their best, and it just doesn't work because the kid has a lack of dopamine and norepinephrine in their brain. So some people think that if ADHD meds work, then it means that the person has ADHD. This is also false. Most ADHD medications prescribed are stimulants, and stimulants will help anyone really stay awake and pay attention, increases dopamine and norepinephrine. So in a normal person, if you take ADHD meds, there will be an overflow going to these receptors, and that will cause for more attention and impulse control. Most people in the population, when they take ADHD meds, are going to pay better attention. So just because meds work does not mean that there is a clear cut, you have ADHD. Some people wonder what causes ADHD. Some things, it's mostly a genetic disorder, as I've said multiple times. It's a lack of dopamine and norepinephrine in your brain. Also smoking, using alcohol or drugs while a kid is in the womb, that will cause ADHD. Sometimes abuse and neglect in the home will cause ADHD. Lack of social environment for a young kid, exposure to environmental toxins as a young kid, one of these being like lead, traumatic brain injuries, concussions being one of them. Now we are going to talk about support for families who have a loved one with ADHD. What is most highly recommended is therapy. Therapy is conducted by a board-certified psychiatrist or psychologist. That person will act as a mediator in conversation to help you talk to your loved one with ADHD. One recommended option is group therapy. This is when the whole family comes in, so parents, siblings, Any other loved ones who are in the home will come in with other families who have someone with ADHD, and they'll talk and kind of support one another, share what works for them, what doesn't work for them, things like that, so that the person with ADHD can get like the best and most support that they can. There's also support groups for just parents of kids with ADHD. There's also one-on-one therapy with a therapist and the family who has someone with ADHD. There's also one-on-one therapy for just the parents with ADHD. You can also have one-on-one therapy with siblings. There's a lot of variations. You just gotta find what works best for your family. One big thing that can be beneficial for parents that have kids with ADHD is creating a reward system at home. So when a kid does their homework and sits still and is good about doing their homework for a certain amount of time or whatever, then they get some sort of treat. Also, like if you tell a kid to stop once and they stop and they don't continue to fidget or talk over you, and can kind of control their behavior better than normal, then they can also get a reward, like food, candy. Oh, you get 30 minutes of extra of TV today. You get time to play on the computer. These are all things that you can use to help reinforce those good behaviors. Now I'm going to talk to you about different treatment plans for people with ADHD. A treatment plan is basically multiple things used cohesively to help cope with and lessen the symptoms of ADHD. So first, let's talk about medications. There are stimulants and non-stimulants. Stimulants mostly deal with increasing dopamine in the brain, where non-stimulants increase norepinephrine. Stimulants definitely keep a person awake more. It's like taking a lot of caffeine, and non-stimulants don't do this as much. With non-stimulants, in adults, some antidepressants such as selective serotonin reuptake inhibitors such as Prozac.
Side effects of Prozac include nausea, upset stomach, constipation, headaches, anxiety, sleep problems, insomnia, drowsiness, dizziness, nervousness, heart palpitations, loss of appetite or increase in appetite, weight changes, cold symptoms, stuffy nose, sneezing, sore throat, dry mouth, increased sex drive, impotence, or having difficulty having an orgasm.
And Lexapro.
Side effects of Lexapro include drowsiness, dizziness, sleep problems, insomnia, nausea, upset stomach, gas, heartburn, constipation, weight changes, dry mouth, yawning, ringing in the ear, decreased sex drive, impotence, or having difficulty having an orgasm.
Other non-stimulants include atomoxetine.
Side effects of atomoxetine include trouble sleeping, insomnia, dry mouth, cough, decreased appetite, upset stomach, nausea, vomiting, dizziness, drowsiness, irritability, constipation, skin rash, itching, increased menstrual cramps, impotence, loss of sex drive, or trouble having an orgasm.
And guanfacine.
Side effects of guanfacine include drowsiness, dizziness, dry mouth, constipation, tiredness, nausea, headache, stomach pain, weight gain or irritability, severe dizziness, slow heartbeat, fainting, or mental mood changes such as depression, hallucinations, or thoughts of suicide.
For stimulants, there is Adderall.
Side effects of Adderall include nervousness, restlessness, excitability, irritability, agitation, dizziness, headache, fear, anxiety, agitation, tremor, weakness, blurred vision, sleep problems, dry mouth or unpleasant taste in the mouth, diarrhea, constipation, stomach pain, nausea, vomiting, fever, hair loss, loss of appetite, weight loss, loss of interest in sex, impotence, difficulty having an orgasm, increased blood pressure, increased heart rate, and increased heart palpitations.
5-vans.
Side effects of 5-vans include anorexia, anxiety, decreased appetite, weight loss, diarrhea, dizziness, dry mouth, irritability, sleep problems, insomnia, nausea, abdominal or stomach pain, vomiting, increased heart rate, constipation, jittery feeling, mild skin rash, an unpleasant taste in your mouth, headache, nervousness, sweating, and restlessness.
Concerta.
Side effects of Concerta include stomach pain, loss of appetite, headache, dry mouth, nausea, vomiting, sleep problems, anxiety, dizziness, weight loss, irritability, vision problems, skin rash, nervousness, numbness, tingling, and cold feeling in the feet or hands, and sweating.
Ritalin.
Side effects of Ritalin include nervousness, agitation, anxiety, sleep problems, insomnia, stomach pain, loss of appetite, weight loss, nausea, vomiting, dizziness, palpitations, headache, vision problems, increased heart rate, increased blood pressure, sweating, skin rash, psychosis, numbness, tingling, and cold feeling in your hands or feet.
With both stimulants and non-stimulants, they both help control impulsive behaviors, help boost focus, and helps a person sit still a little more. Both of them do that. It just really depends what works best for you or your child. With medications, it's a really trial and error based. So some medications will work for some people and other medications won't. A psychiatrist is the one to prescribe medication, and they'll start with what they think will work best. And if that doesn't work, then you'll come back. They'll prescribe a different medication, see how that works for you, if it works better. Just really trying to decide which one is the most beneficial. Another aspect of treatment plans is therapy. Research shows that therapy alone for ADHD is not as effective as medication. However, adding therapy to a medication can be highly beneficial, and it's not to say that therapy is not going to work alone. It's just not as likely to work alone. Medications have a 70 to 80% success rate with people who take them in benefiting them. Therapy, there's not a clear-cut percentage, but it's less than that. Therapy with, a professional one-on-one with a person suffering from ADHD can be beneficial. They can learn to cope with things in these therapy sessions. Another aspect of a treatment plan that can be very beneficial, especially for children, can be accommodations in school. The Individuals with Disabilities Act requires by law that teachers in school provide accommodations to those where it is deemed necessary and where the student is eligible. Just because a student has ADHD does not automatically mean that they will be eligible. Basically, some accommodations can include, increased space between desks, a student sitting closer to a teacher so that they're right there and it'll help them pay attention better. Having like an exercise band between the legs of their desk so that they have something to do with their legs, and it'll help them or have something for them to move so that they can better focus on what's going on in class. Another thing is like having an exercise ball to sit on. Once again, you're moving, and so the hyperactivity portion of ADHD is kind of satisfied, so it'll be better and easier for this person to pay attention in school. Also, having shorter assignments, this will help the student with lower attention spans to be successful. Also having tests and quizzes in alternate settings with extended times. So an alternate setting will be a setting that's not the classroom, where there's less distractions and where that's quieter, so it makes it easier for the student to focus. The extended time will help them with the shorter attention span. They're not going to be able to pay attention as long of a time. They're going to get distracted. So that extra time will really help them be able to finish the test and quiz. Other things in school that can be beneficial would be like an extra set of notes or pre-written notes from a teacher. So with those long lectures, the inattention can make it very difficult for a person to take notes. The shorter attention span also makes it hard to take those notes and really pay attention the whole time. So having an extra set of notes or a pre-written set of notes can be very beneficial for a person with ADHD. Also having more school supplies, more pens, pencils, as I said earlier, extra sets of notes, extra books. This like one for at home and one for at school. These can also be very beneficial for a child because once again, the lack of organization makes it difficult. So if there's like a set of school supplies at home and a set of school supplies at school, then it makes it easier for the child, decreases that chance of them forgetting a book at home or important materials at home. So that's another thing that you can do to help support a child in school. There's also, activities and things that you can do to boost dopamine and norepinephrine in your brain. Some of these include, listening to or playing music, meditating or doing yoga, avoiding foods with excess amounts of sugars and fats, also getting regular exercise. These are all things that you can do to help naturally boost that norepinephrine and dopamine.